Well, hello everyone, and welcome to our Providence Healthcare Leadership Town Hall. I'm Colleen Fox, and I have the privilege of serving as the Chief Philanthropy Officer for Providence here in Eastern Washington. And on behalf of all of us at Providence, I'd like to thank you for your loyal and generous support. For over 135 years, in times of challenge and adversity, philanthropy has been a source of strength for our ministries, and that legacy continues through all of you. We are fortunate today to have three outstanding speakers here to provide a leadership update. We have Peg Currie, our Chief Executive here in Eastern Washington, Dr. Dan Getz, our Chief Medical Officer, and Shelby Stokoe, who serves as our Chief Finance Officer. We're going to have time for question and answer at the end of the presentation, so feel free to use the chat feature that's on the right side of your screen, and we will get to as many questions as we have time for. If there are questions that we're not able to answer today, we will follow up with you after the presentation. Before I hand it over to Peg to start our leadership update, I did want to provide just a brief reflection. As we think about COVID and we think about the crisis, a lot of times we're following the numbers in terms of cases and positivity rates and what phase that we're in. But I wanted to share the perspective of one of our ICU nurses regarding a patient that she took care of here over this fall. She wrote, "My first COVID-19 patient was a woman in her late 80s. No families were allowed to visit. My grandpa died last year, and I couldn't imagine having not been at his side when he passed. The patient told me that what she dreamed of as a child. She asked me about my family. Her family said goodnight on the iPad at bedtime, but the rest of the time she had me and other nurses who stepped in during breaks. We don't want anyone to die alone at Sacred Heart." Literally a moment before she passed, she looked at me and said, "I'll say hi to your papa for you." I will never forget this patient. I will never forget this experience. It taught me that we are here to give 100% of our hearts to our patients. And for me, this reflection just really spoke to what I know to be true of Providence, that even in times of immense darkness, our caregivers on the front lines every day, through living our values of dignity and compassion, shine light. So at this time, I would like to turn it over to our first speaker, Peg Currie, to give a leadership update. Peg?
Thank you, Colleen. That reflection is beautiful. And as we reflect on this last year, and yes, it's been a year that we've been in this COVID-19 situation, there have been many stories like that, many heartfelt moments, many joyful moments as well, with new children being brought into the world and successful surgeries and all kinds of things. But COVID has been kind of the thing that's really a lot of us have had to revolve around because it's just been so different. I'm really pleased to inform you that our inpatient COVID-19 inpatient numbers are down. And everybody's smiling around our hospitals right now because it's really a great relief to kind of come up for air and do the things that we're more used to in a traditional sense here at our hospitals and our clinics. It's also a time, though, that we spend reflecting on what the 12 months were before us and how to stay resilient or work on our resilience or, really be a support to colleagues and one another. It's just been quite the year. We do anticipate that the governor will be increasing our phase here in Spokane County next week. Everybody's looking forward to that. And with that, we are going to be relaxing a bit on our visitor restrictions here in that we haven't been able to have people visit in our adult areas at all, for that matter, except for end of life. So starting next week, we will be allowing one visitor in those adult units, and I think that will bring a great sense of relief to families, also to caregivers who see the sadness by people not being able to be together, but at that same time, keeping our caregivers and our patients safe by making sure that we don't increase the opportunity for this virus to continue to spread. One of our most joyful moments has been in our vaccination clinics. And, I've given personally over 600 immunizations for COVID-19 this spring. And it's a very powerful thing to see the joy in someone who's receiving these vaccines. Certainly, initially in December, we began giving it to our caregivers for those on the front lines and those at very high risk that work in our organizations. And that was really an amazing experience. Once it opened up to 65 and older or multi-generational families, again, there was that joy and exuberance and relief in these rooms, and it was like people could feel the light or see the light at the end of the tunnel and feel that, way of understanding that this wasn't going to be life like this forever. So this continues, even though about 10% of our population here in Spokane County has now had their first and often their second immunization now. But you still see with every one of these people just this relief that it just brings this warmth to your heart. That's just been a special thing. January was pretty rough here. So to see, with the increased vaccine inventory and to see patients and families in our community come in for those and feel like, life is going to get a little bit more close to a new normal that I think we can cope with. It's going to be really, really wonderful. Our community's really been pulling together in a way that I've never seen in my last 40 years. We've all been pitching in with the health district and with many of our adult family homes, long-term care centers, to really make sure that their needs are getting met, resources are getting to them. You'll probably recall at the beginning of this, we didn't even have enough masks and specialty masks and gloves and gowns and all the things that we needed. And some of these smaller organizations still have trouble accessing those. So Providence has played a very, very big part, as have others in the community, to really keep our community safe. And I'm so proud of Providence to be a leader in this way. You may remember that in 2015, we were named one of the only 10 in the entire country special pathogen centers. And what that meant was that we had the expertise to deal with the most virulent, the most awful viruses like Ebola. And I felt so fortunate that we gained that, but it was because of who we are and our energy and our enthusiasm about not being afraid, but taking care of our community. And that helped us with this go around with COVID-19 as well. Colleen and many of you and many of our leaders and caregivers have really assisted in giving to our patient emergency fund this year. Certainly you might expect Philanthropy took an interesting turn and twist this year because people didn't know if they were going to have jobs, or if their businesses were going to close, or if their family was going to be able to have insurance, and how were we going to care for children who couldn't go to school. And through this emergency fund, the giving and the gifting and the compassion from a standpoint not just of time and talent, but of treasure, was a remarkable thing to see. And I compliment you, Colleen, and your team's ability to pivot with these really unprecedented times that we've experienced through COVID. Our community benefit program has just been essential for relief for many in terms of food donations and dollars to continue to keep homeless shelters open and keep shelters open that receive funding in different ways that the funding wasn't coming in anymore. And it's really been an experience. Becky Nappy, who is our director of mission, wrote a beautiful diary, if you will, of COVID-19 chronicles, and she illustrated interesting pieces of what everybody experienced through every month of this last 16 months, from the time that the Diamond Princess folks came from the cruise ship to the moments that we are in today. And it's been a remarkable journey. And Providence has been steadfast in their willingness, their ability, and their mission to care for the poor and the vulnerable. So with that, I'd like to go ahead and turn it over to you, Dr. Getz, our Chief Medical Officer for our Spokane hospitals, to get into the nitty-gritty of what life's like around here and what's going on in our medical world.
Great, thanks, Peg. No, I think we all come forth today with just boundless optimism. It's great to be in a position that we're in right now. Although we don't want to declare victory too early, I think we're in a position where we see that we're moving forward. We have a solution to the problem now. It's just a matter of getting vaccine in arms, and then we can get back to, life as normal. When we look at COVID numbers in our community, Shelby shared some information across the system that we're back to levels that we were early on in pandemic, and the lowest that we've seen in a number of months. And case rates per 100,000 across Washington State continue to trend down. Eastern Washington, we're at 176 cases per 100,000 for the past 2 weeks, and Spokane is at 175 cases for the past 2 weeks. Stevens County at 202, and we continue to see steady declines in hospitalizations as well as case rates, which means that we're doing all the right things. And I think it really lends itself to interpretation that the vaccine approach that we're taking in the state is working. We're at the point now where we're getting vaccine in arms, and not just arms, but the right arms. We're seeing our most vulnerable population being vaccinated. There's been a lot of questions and concerns about COVID-19 variants and mutations that people have heard of. And mutation, that's a normal thing for viruses. Viruses mutate, and one of the good things about COVID is, although it's mutating, it mutates much less quickly than, say, an influenza virus. And the research that we're seeing right now and the vaccines that we have available is that they are effective in preventing infection even with these mutation variants. So as long as we continue getting people vaccinated, although these variants exist, they should hopefully not translate to a significant number of increases in our hospitalizations. And it's important for people to remember, even if you have a vaccine, it's still possible to get COVID. But the benefit of being vaccinated is it drastically reduces the likelihood of developing severe disease. So the vaccines really are a crowning achievement for the scientific community. And I'm usually a pretty optimistic person, but I was a little bit skeptical that we were getting a vaccine out this quickly. And using just incredibly sound science, now we have multiple options for a very, very safe, very, very effective vaccine. So what a great problem to have, trying to figure out how can we get it out quickly enough. And we're doing, I think, just incredible things across our medical community to get vaccines into patients and get back to our normal day-to-day operations. One thing that we're thrilled to be doing is returning to a full surgery schedule. That was probably one of the harder decisions we had to make, and that was a decision that was made in collaboration with the Washington Department of Health, is that we were worried about the impacts of COVID on people that we were bringing into surgery, and we're back to a level now where we can start doing all those cases that were deemed elective cases. And I know elective's a deceiving word for people who are suffering with some sort of illness or some sort of disability that can be healed with surgery. So we're thrilled to be able to doing that again. And also we've worked really, really hard to make sure that we have screening processes in place so we can make sure that we're not bringing in patients with COVID and performing surgery on them, which could increase the risk of complications. And so it's really another testament to the solid leadership and the hard work all across Providence to get us to the point where we can do pre-surgical screening on everybody that comes in for a procedure, as well as testing all of our patients who are coming in for admission, so that we make sure that we're not accidentally putting a COVID patient next to a patient who doesn't have COVID. What can we do to stay healthy as we open back up? And I apologize, you might hear a helicopter in the background as it's landing. The CDC increased some guidance recently regarding vaccinated people and fully vaccinated people. The definition meaning 2 weeks after you've received your second dose of either the Moderna or Pfizer vaccine, or as we start rolling out the Johnson & Johnson vaccine, that would be 2 weeks after the first vaccine. But the CDC guidance, and this applies to non-healthcare settings, so people out in the community, is that if you're fully vaccinated, you can visit with fully vaccinated people indoors, wearing masks, without wearing masks or physical distancing, and that's a tremendous achievement as well, something we thought we wouldn't be doing anytime soon. You can also visit with unvaccinated people from a single household who are deemed at low risk for severe COVID disease. So families, small families that are doing the right thing and keeping them safe, you can bring in safely into your home per the CDC guidance. And then if you've been exposed, it even refrains from testing for exposure if you're not having any symptoms. But what's really important to remember is, although we're in a better spot, we still need to take full precautions when we're out in public, where we don't know if COVID exists or if everybody's been vaccinated. So very important to continue wearing well-fitted masks, physical distancing, and making sure that all those other prevention measures, good hand washing, are taking place. But the more people we can get vaccinated, the quicker we can get back to life as normal. And it's been great. March 31st, we heard that they're going to be expanding vaccine to ages 60, as well as people that have 2 medical conditions, so that's going to help us get back to normal. But again, just to reassure folks, as long as we get people vaccinated, do the right things, we should be in a spot where we're keeping our community as safe as possible and getting back to life as normal. Thanks, Peg.
Sure, that's great. So next we have Shelby Stokoe, our Chief Financial Officer, to speak with you a little bit about what's it mean on the finance side of everything we've been going through.
Great, thank you, Peg. So the 3 big questions I always get around finances and COVID are: first, what has our impact been to date? Second, what about this CARES Act that I hear about? And third, what do we expect going forward? So those are the topics I'd like to cover today, kind of starting with where we have been. And the first thing I want to call out is remembering that Providence has been serving Spokane since 1886. So in that time, there has been the creation of health insurance. We've endured the pandemic flu, or the Spanish flu pandemic. We've gone through the creation of programs, government programs, Medicare and Medicaid. So yes, like all businesses, healthcare has had some significant financial impacts from COVID, but we've been here for 135 years, and I'm very confident that we're going to weather this storm just like we have all of the others. So with that, looking back on 2020 and how COVID impacted us, really simply put, like so many businesses, we had increasing expenses and decreasing revenue. Specifically, our 2020 expenses for Providence Healthcare grew 1.8% over 2019, while our normal operating revenues generated from patient care, decreased 4%. So on the revenue side, that 4% was our patient interactions we had. Once we put CARES on top of that, our revenue decrease was still 1.3%. So the CARES Act was really intended to help us sustain as a healthcare industry, but not make us whole. And that's exactly what we saw at Providence Healthcare. So even after CARES, again, increasing expenses, decreasing revenues. On the revenue side, specifically that 4% kind of patient care, a lot of that was a decrease in volumes, surgeries, procedures that Dan spoke about. Our most significant impacts, not surprisingly, were last April when things really shut down quickly. Our April revenues were down about 35% of normal. We saw some increases over the summer and through the fall. And then again in the winter surge, we saw revenue drop of anywhere between 9 and 12% of normal, depending on the month. We also saw a lot of volatility, as you see, month to month. One of our good accomplishments that we're really proud of with respect to being able to continue to serve patients and also maintain our revenue base was in the clinic setting in our telehealth offerings. Specifically, in the first month of the pandemic, we were able to go from 0% to 25% of our clinic visits offered on the telehealth type format. Today, we're still seeing, depending on the clinic, anywhere between 10 and 20% of our visits being offered via telehealth. So although we did have some drops, we had some great success stories as well, where we were able to sustain that revenue base again by continuing to see patients just in a different way. On the expense side, again, we saw expense growth in 2020 of 1.8% over 2019. Things that drove that were things like personal protective equipment, as Peg mentioned, masks, gowns, etc. Access controls. Anybody who's come to see us in the last year, there's sometimes physical barriers. We have new caregivers taking temperatures and those kind of things. We're doing more lab testing, screening before surgeries and procedures. We've really, again, ramped up our telehealth, so we've made a technology investment. Length of stay in our hospitals has grown as we've been challenged with nursing homes and those kind of care settings who are having trouble accepting patients because they're seeing their own surge. Sometimes a patient stays in the hospital a little bit longer than they need to. So all of those things are driving costs. For 2021, we budgeted almost $8 million in new costs that we expect that are COVID related that we will expect to continue at least through 2021. Looking forward, one of the things that I really like to call out is that the impacts of the pandemic will last far past the end of the pandemic, and we don't yet know what all of those are going to be. So the expenses as an example that I just listed, we know we expect those to last through 2021. Some of them may end at the end of this year, others I suspect will continue into the future. After the recession in 2008, it actually took 18 months for that to financially impact the healthcare industry. So we do expect, again, for these things to continue for quite some time. Likewise, there's things like our payer mix that are a little bit uncertain. In healthcare, we get paid more for a commercial payer, somebody who has an insurance plan through their employer, than we do by government programs, a Medicare or a Medicaid, as an example. So one of the things that we've seen as people have gone on unemployment is we're really monitoring closely how many of those people we think might go back to returning to employment and getting back on commercial insurance versus perhaps staying on Medicaid or perhaps not being insured at all. So that's something we're monitoring really closely, and we don't know yet how that's going to look a year, 18 months, 24 months from now. We're also actively monitoring what portions of our business might change permanently. An example of that is in 2020, our emergency department visits were down 20% from what we saw in 2019, and that's very common across the industry. We suspect some of that is we had a much slower flu season than we typically do, and those do drive emergency visits, but it also might be people choosing to access the healthcare system differently. So again, lots of things that we're monitoring. Similarly, as I mentioned, telehealth has been a great success, something we're very excited about, and that was something that prior to the pandemic, not all payers were supportive of paying for a visit that occurred via telehealth. As that has ramped up during the pandemic, a lot of the payers have really realized the value of that and have already made changes to their policies to allow us to continue with that telehealth format after the pandemic is over. So we look forward to some of those things as well. So those are a few of the highlights, and appreciate your time today. Look forward to questions during the Q&A, and I'll turn it back to Peg. Thank you.
Well, Colleen, I think you're going to be our moderator here, so back to you.
Thanks, Peg. Yeah, we've got some active questions in the question and answer, so we'll just go ahead and jump right in. So the first question is a great one, and it's one that I know we've been hearing a lot about. It says, there still seems to be a great deal of vaccine hesitancy here in Spokane. Does Providence have plans to provide more information or hold some sort of communications campaign to try and encourage vaccinations so we can end this pandemic more quickly? And Peg, I'm going to turn that one over to you.
Sure, I'm happy to take that one because I'm all for that. We really started jumping on that bandwagon right away. And you might have seen Elaine Couture give the very first shot for Providence to one of our kidney transplant surgeons, Dr. Oke Joho. And that was on our social media. It was on several of the TV outlets here in town. And not only was it a celebration of that, but it was a physician saying, basically by receiving it, this is okay to get. And he's also from Nigeria. So he is a person of color, because it's very important for us in health equity to make sure that people of all ethnicities know it's okay to take this vaccine. So that was where things started. Internally within healthcare here with our caregivers, we had had a lot of communications with them. And as you remember, phase 1A was for healthcare workers. So we really had to give them the information about the vaccine and what it meant. And you might imagine, and maybe you've heard, some of the younger people in our community here at Providence, as well as in Spokane and Stevens County, that some of our younger women were afraid to take it because they were hearing unfounded rumors that it was going to cause infertility or something with their child, or if they were pregnant, they were afraid to take it too. And all of that has been unfounded to date. So we've had to do a lot of internal, information, kind of like Dan said a little bit ago. I mean, things happened so quickly that this vaccine was produced that it made people feel a little skeptical. But since more and more people are getting this vaccination, we're just seeing great results. It's such a right thing to do. Going forward, well, Mark Schemmel joined Dr. Frank Velasquez of the Spokane Regional Health District just this week to message on Facebook Live on their website about to that specific audience about fertility and what's real and what's not real if you are young, you're pregnant, or you're planning to get pregnant. And we've been part of other FaceTimes with the Spokane Regional Health District as well. We are going forward going to be more aggressive in encouragement with this. As the inventory grows, because we haven't had a lot of inventory to date, as the inventory grows and it opens up to a broader number of our citizens here, we are really going to push that message. We need to push that message. Dan, do you have anything to add to that?
No, I think that was a great description, Peg. I think is those people that have been sitting by the sidelines just waiting to see what happens, I think they're getting into play more. We're seeing more of those people scheduling visits because although the scientific evidence showed that it was very safe, people just wanted to see. And I think as the literature shows more and more, it really keeps people safe. We're going to see better adoption of the vaccine, and physicians and advanced practice providers, those people working in primary care, or even like Dr. Schemmel in obstetrics, are really well educated in having these discussions with patients who are a little bit leery. Is this the right thing to do? And I think that's been the tough thing with social media. A lot of people weren't making their decision based in science. And as the science becomes stronger and they're able to have these conversations with healthcare professionals, and they see role models in our community like Dr. Ojoho or even Peg and Elaine getting vaccinated, it helps ease some of that fear that this is a dangerous thing. When the science is very clear that the vaccine is safe, it's highly effective and a tremendously better option than getting COVID itself. So it's great to see that, and all the work that people have been doing to help encourage certain members of the community to come forth and get vaccinated.
Colleen, do you want us to go to the next one?
Yeah, I'll just jump right in. Thanks to both of you for filling that in. So this is a question that I've been asked by a couple of donors. How does Providence make decisions about how it distributes its vaccine allotment and how it gets that out to the public at large? And Peg, I think I'll kick that one over to you as well to start off.
Sure. I wish we got what we asked for. We really don't have a lot of say in the matter. When this first started, we basically gave the Department of Health the number of healthcare workers that we had that would be eligible for the vaccine. And then vaccine inventory started to come into us, and it was the same in other healthcare locations as well. And as things opened up more to the 65 and older group, then we started asking for more allotments to give within our hospital clinics and others as well. Spokane Regional Health District as well, CHAZ as well. And we rarely got, and we still don't get what we ask for because the inventory just isn't there to give. So pretty much what we get in our whole community, and I'm speaking from all places, including the mass vaccination site, we ask for more than we get. And we want to ramp up to be able to do a lot more. We have the personnel to do that. We just don't have the inventory of vaccine yet. So the decisions are based at the Department of Health and how that's distributed, which counties that's distributed to. There's even decisions made by the Department of Health county to county, because if certain counties are a little more averse to vaccine, and for instance, we got several doses from Walla Walla to our PMG clinics because they received more than they had people sign up for. Now that's changed in that community now, kind of similar to what Dan says. People saw that they weren't going to grow an extra arm or head or anything. It's okay to get it. But in the meantime, they've been redistributing from county to county where that abundance occurs, and then putting it somewhere where there's waiting lists or waiting, lots of people waiting for appointments. I think that I hope that we get to the day where we have more inventory than we have people that haven't received the shot itself. Thanks, Colleen.
Thanks, Peg. So the next question I'm going to give to Dr. Getz. How has the pandemic affected mental health in our community, and are we seeing increases in our pediatric patients specifically with schools being closed?
It's a great question. Yeah, the pandemic has adversely affected everybody's mental health. This may want to be the few years on record where I think, dog years are 7 years, humans were probably 12 years this year. So, across the board, across the country, we've seen increasing visits for mental health. We've seen, increasing issues with certain addiction rates. So, we've got our work cut out for us in helping address the needs of our community. And that's one of the big focuses of Providence, is really increasing access for mental health in the community, not just for adult patients, but for pediatric patients as well. And I think we're going to see, just like Shelby mentioned, ramifications financially for years to come. We're probably going to see that in, certain disease processes, including mental health. And so we're really going to have to work on doing screening programs and work on suicide prevention and all these different things to get people back to normal health. And just like it's an economic recovery process, this is going to be a big concerted effort of recovery towards regaining our normal health and well-being. And yeah, the pandemic has not been good for mental health across the country, both adults and children.
Oh, Colleen, you're on mute.
Thanks, Peg. Yeah, there's no question that this isolation is certainly having an impact on all of us in different ways. So this next question is a volunteer question from a couple different perspectives, but I'll combine it into one. One person asked about information regarding volunteer opportunities for vaccine clinics. Is Providence partnering with Spokane Regional Health District to sign up or to assist at vaccine clinics, and how would people sign up? And then conversely, I know we have some of our wonderful volunteers who are on this call, and they're wondering when we might be able to welcome volunteers back to our campuses. So Peg, I'll send that one over to you.
Sure. So we have had a lot of people step up that are healthcare providers for the clinical needs of these vaccination clinics. Right now, at this point in time, for the arena, Safeway Pharmacies is going to be taking over the responsibilities of staffing that. So that twist just sort of happened in the last week or so, and they are assembling the volunteer pool that's going to be doing that. They're using people that are Medical Reserve Corps members. If you'd like to sign up to be a Medical Reserve Corps volunteer, you can do that. Just Google Medical Reserve Corps for Washington State, and that will get taken care of, and they'll reach out for you. For the non-clinical roles, like checking people in or showing people where to go, we've been able to get a lot of people to be able to step up and volunteer. So for our Providence-based clinics in this moment, while we have this level of inventory, we pretty much have this covered. If there are those of you that are clinicians that would like to volunteer at the Providence Medical Group locations out the Valley or the Spokane Teaching Health Clinic, please contact Johanna Baker, who is our Director of Volunteer Services, and she'll make sure to hook you up, or go ahead and apply for the Medical Reserve Corps. I think there'll be more volunteer opportunities and that information will get distributed by the health district on their website, as well as in newspapers and on TV media as well. Right now, we're sitting pretty well for Providence itself for the amount of vaccine that we have. Thank you.
Thanks. So, Dr. Getz, any information or insight you can provide on the Johnson & Johnson vaccine, and will Providence be administering that vaccine when it becomes available?
Sure. Johnson & Johnson vaccine is a great vaccine. The best vaccine for you is the vaccine that you can get. And so, although I know people have asked questions about, well, the efficacy rate or the effective rate is in the mid to high 70s compared to the 90s for the Moderna, the Pfizer. Effectively, when you look at the way this virus transmits and how herd immunity works, it's basically the same number. So that vaccine will keep you very, very safe, and vaccination is a team sport. And so if I get vaccinated, I'm not just keeping myself safe, I'm keeping members of the community next to me safe. And so I can't transmit the virus to them and allow them to transmit it to the next person. So the virus is effectively neutralized in the vast majority of patients that get the Johnson & Johnson vaccine. It's a little bit of a different, it's a more traditional model of vaccine compared to the mRNA vaccines, which are the Pfizer and the Moderna. It uses what we call an adenovirus vector to get your cells to produce this little bit of spike protein, which is a little bit more traditional. But again, from an effective rate, all three of the options that we have right now are just wonderful options. So if that's the one that's in front of you and you haven't had a vaccine, that's the one we want you to receive.
Thanks, Dr. Getz. I like that slogan. The best vaccine is the one that you can get in your arm. I think that's a good perspective for all of us to have. So this next question I'm going to send to Shelby, who, in addition to being our CFO, is also on the foundation board. And whoever wrote this question is my new favorite donor. So thanks for participating. It says, how does the foundation contribute to the mission of Providence? Can you think of an example of a project that without the foundation support wouldn't have happened?
Oh my gosh, I can think of lots of examples that wouldn't have happened without the help of the foundation. So one of the things that the foundation is incredibly supportive in is our patient financial assistance. So, you know, outside of a COVID situation, think of an example of somebody who has received a cancer diagnosis, and a lot of those require several trips, whether it's chemo or something else. And we very regularly have patients who need to come in on a recurring basis, who maybe need help with gas or transportation. It's the simple needs, kind of some of those wraparound services that a lot of patients need help with. I'm a huge believer that relieving that financial stress is part of the healing process. And our ability at Providence with the foundation support, with all of your support, to wrap around patients like that for their care, I think is incredibly powerful. In addition to some of those things that are kind of always been part of our mission, you know, COVID is a great example. Just like everybody else, the Pound Foundation in 2020 pivoted big time, and there have been a lot of COVID specific things that the foundation has been able to support. One great example of that is as we moved different screening sites, you know, from maybe inside an urgent care, for example, to the parking lot. Our foundation has been able to support kind of that different care model and making sure that we can take care of both our caregivers and our patients on pretty short notice. Some of the things that have been pulled together, I'm thinking of an RV specifically, we couldn't have done, you know, just on a few days' notice without the foundation support. So those are just a couple. I can probably take up the rest of the town hall giving examples, but those are hopefully helpful starting points. So thanks for the question.
Well, thanks, Shelby. So for our last question, I'm going to let all of you answer this just kind of one by one. And I think it's a great question as we head into spring and as we all start to come up for a little bit of air. What's giving you hope or optimism for the future? And Peg, I'm going to let you take this one first.
I think that the team that we work with in the Providence community, because when bad things happen, people they band together like no other times. And, you know, it's unfortunate that that doesn't happen every day and, you know, just sort of a normal average day. But when really tough things happen, like this pandemic has presented us, the approach and the collegiality and the expressions of grief and suffering and the expressions of what wonderful thing just happened are raised to a new level. And when I think of standing on the shoulders of those before us, the Sisters of Providence, I think they would look at us and be so proud and so supportive and so honored that what they started has turned into this. at all of our ministries in Spokane and Stevens County. I think that it's been a remarkable journey, a tough journey, but the hope and optimism of what human kindness, compassion, spirit, and excellence can bring to a very, very difficult situation. How about you, Dan?
Yeah, I think the resiliency and just the compassion that we've seen among our community, the Sisters of Providence serving the poor and the vulnerable, the outreach that we're seeing to help people get vaccinated, to take incredible care of people that come down with COVID and require hospitalization, and still focusing on the quality and the safety and providing excellent care across the spectrum, I think has just been incredible. In this past year, the tremendous response, just like the questions about where can I continue to volunteer, where can I volunteer, everybody wants to help support others at need, and I think that really just speaks to the mission of Providence and the wonderful job that the mission continues to serve in all areas.
Shelby, do you want to jump in?
Yeah, I would love to. Mine is very similar. For me, this is just about people, and in particular, it's been really fun for me to see, Peg and Dan and Colleen and I all get to see our fellow Providence caregivers every single day. And we know what great work we do as an organization. We know how well we take care of our patients. But it's also very much in our culture to be very humble. And it's been an honor for me to kind of see our caregivers' great work kind of put in the spotlight over the past year so that everybody can see the really great work that our nurses and doctors and environmental services and everybody else does every single day. And so, yeah, it's really about the people that have been our legacy, and I know we're going to continue to carry us into the future.
Thanks, Shelby. Well, I think that we will, there's a couple questions we're going to answer offline, but I'll answer that question too in terms of what gives me hope and optimism for the future. There's a great quote from Mr. Rogers that says, when things are crazy and chaotic and the world feels really scary and out of control, you look to the helpers. And I certainly see the helpers and the caregivers on the front lines of this pandemic every day. I see the helpers in the vaccination clinics that I've worked at. And I also see the helpers in the donors who show up and who just want to make a difference and want to be a part of the solution. And so to close our time together, I want to read a quick email that I got from somebody that I consider a helper. This was a couple who made a large contribution, a major gift back in the fall. And they said, we want you to use this in the way that makes the most difference right now based on the needs of Providence. And so we directed their gift to the COVID-19 Relief Fund. And shortly after, Shelby mentioned, we got a request to be able to stand up a testing site out in the parking lot of the PMG site. That was right at the kind of as things were starting to surge, and they were looking for a way to be able to test a lot of people very quickly without having to get them out of their car. And thanks to Philanthropy, we said, yes, we can make that happen. No problem. We'll get this done. And so this couple was able to attend one of the Providence community vaccination clinics. And they wrote me this really kind note that said, my husband and I were totally amazed and very grateful to the teaching building for our vaccines today, having been a bit apprehensive about the whole process. First, the directions were great and parking was a dream. The whole experience was positive, very organized, and very professional. At the same time, without exception, the people who helped at every step were kind, outgoing, cheerful, and seemed genuinely caring. Qualities I would think you would be so happy as representing Providence at its best. I saw customers like us, initially tense, relax when they stepped through the door and were greeted, indeed welcomed, by a charming, knowledgeable woman giving directions and help. There was laughter and camaraderie evident in the rooms. Each and every person we interacted with gave us confidence in the whole process. Bravo to everyone at Providence who made this happen so beautifully. We love Providence and are grateful for all the positive experience we, our family, and our friends have encountered there over many years, from emergency rooms to hospital stays, doctor's appointments, etc. This was another great example. And so I think that really captures what we're here and what we're about, is that regardless of the situation, Providence will be there to greet with a friendly smile and to be one of the helpers in every instance. So again, thanks to all of you for joining us today. Thank you so much to our speakers for making time to share their perspectives with our donors. And here's to a beautiful spring evening. I hope that you enjoy it and that there are many, many bright days ahead. Thanks, everyone.